Good morning. It's Thursday, March 11th. Welcome to The Doc is In, Ask Dr. Already. I'm Sybil Madison, your Deputy Mayor for Education and Human Services, and I'm here with Dr. Allison Already.
Morning.
She's your Commissioner for the Chicago Department of Public Health. This is where you get all the latest on COVID-19, on vaccine, and most importantly, it gives us a chance to answer your questions. You can put them in the chat box below. You can also send them to us using Facebook or Twitter and the hashtag AskDrArwady. We're going to start off by checking our distance.
Looks
Still
good.
a very important thing to do. All of those basic things that we know stop the spread of COVID should still be in place. And we thank all of Chicago for doing that so well. How about we hear about the latest data?
All right, so as always, chicago.gov/coronavirus. That's your one-stop shop for everything related to COVID. You can get to the vaccine page directly from there. You can also get there directly, chi.gov/COVIDvax. The dashboard is chi.gov/COVID-, and if we pull it up here, you'll see that we're doing very well. We're at a 2.8% positivity right now. That's really been fairly flat. It was 2.9% a week ago, continues to hold at a good low level, doing about 11,600 tests per day, really flat. Also, you can see that's down just 1% from a week ago, basically flat, and at a good level. And we're averaging 271 cases per day, down from 288 a week ago, also essentially relatively flat.
But it's worth noting the positivity level is the lowest that we've ever.
Yeah, the 2.8% is right about the lowest that we've been. We hit 2.7% yesterday. We're at 2.8% today, but they're in the same range. Yeah, we're sitting really at a pretty good spot here. Our deaths have come down. We're averaging just 4 deaths per day. Again, not quite down to where we were over the summer, where it was just 2 to 3 per day, but it's heading in the right direction. Every day, our hospital numbers look better. Our ICU numbers look better. Our patients on ventilators look better. All the metrics that we're following do continue to head in that right direction. My main concern is that case rate. 271 cases per day is still quite a lot of cases. We need to get under about 200 cases per day. We were there over the summer, although we were doing a little less testing, to be at a point where we would really be lower risk. Still not low controlled, but sort of in that lower risk category. But generally, the numbers are looking really good. And as I mentioned, I think the last time we were on, one of the nicest things to see is that we're not seeing those big racial and ethnic disparities in our case rates like we were for most of this outbreak. Partly because we've been doing a lot of really focused vaccinating in the highest hit communities. We're now seeing even those Latinx rates that had been high for weeks and weeks are basically down now and in the same range. So we're seeing really equivalent rates for people who are white, who are black, who are Asian, who are Latinx here in Chicago, very reflective of Chicago's population. And that, that's good news for everybody. It means that we're getting some of these pockets of COVID under much, much better control and using this vaccination in really targeted ways. And people are continuing to be careful and do the right things, especially in some of these hardest hit communities. So really nice progress.
That's a huge shift because
it is.
The line on the graph for Latinx Chicagoans has always been way up there. So
yes.
To see all of those.
To see it all down really in line and see how that's come in, even as vaccinations been rolling out, especially in 1B, it's really good to see. And of course, for everybody, when we decrease especially, any of these higher risk settings, decreasing cases, decreasing spread, whether that's the nursing home, whether that's the factory, whether that's the neighborhood, that in turn protects everybody against variants, because when we spread is when we have the opportunity for variants to emerge and for them to spread. And so it's really the best thing. People sometimes say, this equity strategy, why are we always talking about equity? A, we want to make sure that people actually are able to access the vaccine. They're getting the extra support they may need based on their circumstances. But B, from a public health standpoint, you want to get past COVID, you've got to make sure your hardest hit areas of whatever you're looking at get access to vaccine first and with the lowest barriers. Doing that helps protect everybody sort of in the population. So it's I kind of like infectious diseases in that way. They really highlight that if you ignore inequities, you hurt everybody.
Yeah.
So
yeah. You like infectious diseases. I
Well-
think that's what I heard you say.
You know, I always have to be a little careful here. I, of course, do not like COVID,
I know, Dr.
I
Harvey.
find the epidemiology of infectious diseases endlessly fascinating.
It is.
And I do think, you know, COVID, it's no secret, has really highlighted, I think, for a
sure
lot of
has.
people, all of the inequities in our society, like the ways in which opportunities people have, whether that's in housing, where do we have crowded housing?
Yeah.
Whether that's in
Employment.
essential workers, employment, transportation, like all
Yeah.
of these pieces,
Access
income,
to healthcare.
access to healthcare. Do I have a primary care doc? Do I have insurance? You know, what are my opportunities? Those have really showed up in a way that I think have become visible. It's not that they haven't been there. Of course, the health department, we've been very focused for a long time on a lot of these inequities, but I think the conversation has become very clear. And when you're talking about COVID, any part of your city that is in poor control from a COVID perspective puts your whole city at risk. And I actually think, right, there's this analogy that actually goes beyond the infectious diseases, but it
Yes.
kind of brings it to light for people. And so, you know, some of the long-term work that we're doing is really trying to make sure the COVID investments that we are making now will last in a way that will allow us to keep working on the chronic disease inequities, right? These huge racial life expectancy gaps. It's about 9 years different almost.
Yes.
Black Chicagoans live almost 9 years on average less long than other Chicagoans before COVID. Half of that due to chronic diseases,
Yes.
right? What puts you at high risk for death from chronic diseases? What puts you at high risk for death from COVID? Chronic diseases.
Yes.
Where have we seen disproportionately high death rates, right? Like these were in place before, but I'm very hopeful just as a city, as a country, there will be additional focus. We're certainly focused on it at the health department, wanting to make sure that we invest in ways that make everybody's access to health, you know, more equitable really from the beginning. And I mean health in the broad sense, not just health care, so that we are better protected against further infectious diseases as a city.
Yeah. And that's what's exciting about the work that we're doing with Protect Chicago Plus and with the Racial Equity Rapid Response Team, because I think we're strengthening partnerships between community leaders, faith leaders, and healthcare providers in ways that you know we hadn't seen in some of these communities before.
Yeah.
And I think that's going to be beneficial for the long-term fight that we have against those inequities.
Yeah, if you don't know, Sybil herself has been heavily involved in a lot of the Protect Chicago Plus, a lot of the Race Equity Rapid Response Team work really from the beginning. And I do think that this is, you know, it's the sort of thing that we want long term, right? We want to support financially, support administratively, really think about what does it mean to have a healthy neighborhood? How do we bring together various leaders? Health, thank goodness, is one of the things that people generally see as a universal good, and I would argue as a human right, the access to health.
Yes.
And COVID has offered, I think, some really good opportunities, both in a spotlight way and in a resource way, with more to come. With the new federal passage, that's going to be additional funding that's going to let us really build what we need for COVID now. But from the beginning, we've been trying to be as smart as we can about using that money to build, jobs for COVID response, to build opportunities, especially in the parts of the city where that's most needed. So,
Yeah.
man, we got philosophical early here.
Oh, we did.
That's good.
Okay. You ready for questions?
I sure am.
Okay. All right, back to you. At Aaron Shelley 1 from Twitter, is the vaccine mandatory?
No, the vaccine is not mandatory. At this point, the vaccine is still under what's called emergency use authorization from the FDA. My feeling is that, one is that the city of Chicago is never going to say, everybody who lives in Chicago must get vaccinated. The United States government is never going to say everybody in the United States has to get vaccinated. Let's be really clear about that. I think what may happen, once we're at a point where there is much more vaccine available, where everybody's had the opportunity to get vaccinated, where everything is fully authorized, I think we will increasingly see businesses or other settings make the decision to perhaps only allow people in who are vaccinated. I think we're already seeing early examples of this related to travel. There are airlines who have already said, you want to come to Australia. I mean, right now it's sort of a testing or vaccination, but we're going to be at a point, I think, not too long from now where there may actually be vaccination requirements at borders. There may be vaccination requirements even for, being able to do things that folks want to do. But right now, no, the vaccine is not mandatory. There may be individual settings where employers are already starting to make that decision. We've seen, for example, some of the highest risk assisted living type settings really set some policies already that for their staff that is required, but it's not very common. And really the goal at this point is to continue to build confidence in this vaccine. There have been, more than, how many? More than 800, I think we're going to pass 800,000 COVID vaccinations here just in Chicago. I think we'll pass that today probably.
Wow.
And that's in the setting of, more than 80 million across the United States. And it's continued, this vaccine has continued to perform. It's very safe, it's very effective. It's been performing in the real world just as we expected it to from the trials. And so my hope is that as we continue to roll out here, people do continue to have confidence in this vaccine, make that decision to get vaccinated when it is their choice. But no, it is not mandatory. It never will be mandatory for you to get it, like as a resident here in Chicago. But I wouldn't be surprised if down the line there are some requirements around vaccination to be able to do particular things.
Got it. At VaxPMO from Twitter, Chicagoland is short 200,000 doses relative to Illinois per capita. This is somebody who's looking into the data. Chicago gets its own allocation, but the regional shortage pushes suburbanites to seek shots in the city. Have we asked IDPH to send more doses to the region to lighten the load?
Somebody has been looking at the data. So so let's talk about that. Obviously, every single day, as you know, we look at our map here in Chicago, and we look zip code by zip code by zip code. It's all available, chi.gov/COVIDVax, if you want to look at it too. We look and we say, where are we under-vaccinated as a city? We had some predictions using our COVID vulnerability index about where we expected we would have some more challenges, and that's part of why we launched Protect Chicago Plus. But every single day we look at that, and that is the data that we use to make decisions about how to prioritize vaccine access. We really want to work to make sure that everybody in Chicago is able to access vaccine at about the same rate. So for example, when we made the decision for some of those doses at the United Center, right, as we've started to have more, we were able to have more of an equity focus, which of course is what we wanted, chose some zip codes there that were under-vaccinated, significantly under-vaccinated from a first dose perspective, and did not already have Protect Chicago Plus initiatives in there. That's based on the data. So it is definitely a best public health practice to direct vaccine to the parts that are under-vaccinated. Yeah. Obviously, you've got to make sure that there's not vaccine sitting on shelves. You've got to make sure that it's all being used. We, of course, do that in Chicago at an individual provider level. But we certainly have had these conversations with IDPH. I know that the state is looking at this same data, and the best public health practice is certainly to be pushing vaccine, to the parts of the state that are under vaccinated as long as it can be used. So you're right, Chicago does get its own allocation, and we do that work within here. But we do continue to vaccinate, in the given week between about 35 to 40% of our vaccine.
Yeah, I was going to ask because at the very beginning.
Yeah.
When it was 1A healthcare,
yeah.
We saw quite a few folks getting vaccinated, presumably because they worked in the city but lived outside of the city.
Yeah.
But we're seeing still that
we still are seeing between 35 and 40% of sort of Chicago's doses going to non-Chicago residents. I want to put this in some context, though, that we also have about 20% of Chicago residents getting vaccinated outside Chicago. But they're not equal. So they're week after week after week, months in, there is that difference. And really the main reason why, I think the questioner is correct, and you've done a good job of looking at the data. If all of the vaccine were staying in the city of Chicago, we're putting it all in arms. Last week, 97% of our vaccine was in arms within 7 days. But the region, there's just a lot of need for vaccine. And, to be clear, there's not a lot of vaccine. And if people have questions about how much we're getting, I'm happy to kind of get into that, because I think nationally we're hearing, there's so much vaccine, and there is going to be a lot of vaccine in April and May, but we didn't really, right?
See the same.
We've not seen, and maybe I can do the numbers just for some awareness there, because I do think, people are hearing all this excitement about new vaccine coming, and it is coming.
Especially with J&J.
Especially with J&J. But you know what, J&J, like we got a one-time allocation about what, not this week, but the week before, about 23,000 doses for that week. Great. We did not get any more J&J this current week. We are not getting any J&J next week, in fact. And so when you're planning, it can be tricky to sort of know. We're hoping there will be some the week after, but there hasn't been. Our Moderna vaccine has been flat for 6 weeks, right? We've been getting 26,500 first doses of Moderna vaccine to stretch across the entire city every week, first doses. And then our Pfizer has been going up like a little bit. Like I'm happy to see the increases, don't get me wrong. But like this current week, we got 33,930 is the specifics for Pfizer first doses. Next week, we're getting 36,270. So it went up by 2,000. But still, in terms of what's getting allocated to Chicago, this current week, it was around between 8,500 and 8,600 doses per day. Not counting the United Center. This is part of why we've been excited to get all this vaccine. And importantly, not counting the vaccine that's being directly allocated to some pharmacies. So Walgreens is getting some specific allocations from the federal government. We can talk about that. Jewel now is getting some as well. And Yep, so that's been good because it's been some additional vaccine. But in terms of our ability this is where all the vaccine, that's it. Still, next week it'll be still less than 9,000 doses a day that the city of Chicago divides up. We've got more than 550 providers. That's everything that goes to hospitals, clinics, federally qualified health centers, doctors' offices, urgent cares, pharmacies, except for Walgreens and now Jewel. All of that is still just 9,000 doses a day, not counting United Center, which is why United Center, there's 6,000 a day coming in there, 60% for Chicago residents. It adds about 3,600 a day, kind of give or take. So it is a big increase for us. But still, where you think about the hundreds of thousands of people that still need to be vaccinated, we've not seen those big increases yet, and we're not going to see them even this coming week. I think the hope is sort of the week of March 22nd, hopefully the week of March 29th, we'll see quite a bit more increase, and because we want to be able to open up, as you know. So that was a long answer to this question, but I think broadly we certainly have been advocating, and it is the best practice to make sure that you look at that data and and that you send vaccine as long as there are ways to use it to anywhere, wherever it is in the state that is under vaccinated.
Speaking of United Center,
yes,
there are a few questions.
I'm sure there are. Yes.
Okay, so there are 3 that I can see right here.
Okay.
Do you want me to tell you all 3 at the same time?
Sure.
Or take one at a time. Okay,
whatever.
So, these 2 are related. It doesn't look like United Center vaccinations are in the CDPH data yet. At least we don't seem to be seeing a 6,000 jump in first doses yet.
Okay.
Where and how often will United Center vaccinations be reported?
Okay. All right. Good. Stick with that one because there's a lot in that one.
Yeah.
Pause in that one. Okay, so a few things. Number one is that we didn't start off straight away with 6,000 vaccinations. We're ramping up to 6,000 vaccinations
per day.
But all of the vaccine that is not used in those first days will be used. Remember, this is an 8-week engagement. We are 2 days into an 8-week engagement. We're going to be bringing in a drive-through down the line. There's a lot of plans around this. So all the vaccine is going to be used. No problem there.
We're not going to lose.
We're not going to lose any vaccine. But it doesn't start with 6,000. But more to the point, most of those early doses, remember, didn't go to Chicago residents. So and the data that you see here is the data on Chicago residents. And so remember, the first 4 days of sign up for the United Center was open statewide to anybody who is 65 plus. And only about 37% of the people who signed up were in Chicago. It was one of the reasons why FEMA really said you need to make adjustments here and make sure that City of Chicago folks and people who most need access to vaccine get some priority in Chicago. So it's a combination of those things. But United Center data absolutely is already in there. It gets reported a day later, and I know that it's there.
Okay. What is happening with the second dose appointments at the United Center?
Yes. I figured we'd probably get a question on that. So when were we last on? Tuesday. So I had said on Tuesday what I believed to be true that actually turned out not to be true. Every City of Chicago pod that we have ever operated since the very beginning, we have always given the second dose appointment at the time of the first dose. We always make it, that's the best practice. You want to make sure that people get the first dose. Turns out at the United Center, partly because, well, actually entirely because we're using a different tech platform there. We're using the tech platform that the state uses. It turns out that there were not vaccine appointments that were actually being given. Second doses were being held for that person 3 days, exactly 3 weeks later with an expectation that they would get the appointment. So it wasn't that there wasn't a plan, but it turns out that those appointments were not being given. And so once that was recognized, and especially if somebody didn't have an email or didn't have a cell phone, there were some issues with not being able to email text. So, not great, but not a concern because again, we've saved all that vaccine. We have those, if your name is, Allison Arwady, and you got vaccinated on the first day, there is a vaccine that says Allison Arwady, right, on it for 3 weeks later. But I know there was some confusion there, and I do apologize for that. Where we are is that emails have gone out for everybody who got a first dose appointment on either the first day or the second day, and anybody who does not have an email, the call center is actually calling all of those people individually to make sure they have the information about when that appointment is. When in doubt, your appointment is exactly 3 weeks later from when you started, but still, the call center, which just as a reminder is 312-746-4835, can help. But we really wanted to make sure to correct this. So we're calling everybody who we have any doubt that there was some confusion there. And we have changed our practices. Thank you to everybody on my team who really worked really well with sort of the tech team from the state and everything. So as of this morning, people are walking out the door, which has been our practice all along, with an appointment, with a printout that here is when my second dose appointment is. So
a little glitch on day 1, day 2, day 3, corrected and but no one should be worried.
No one should be worried.
Second shot.
And the thing is, I mean, and I am, obviously we want everything to go really smoothly. It's a huge operation, and there's been changes, as you know, and different tech platforms with some of the partners involved, and always I wish we could test everything for 3 weeks before we launched it, but we are very often, just because of how quickly this vaccination is happening, we're needing to sort of make plans and make adjustments, and then very, very quickly put them in place. So
a lot of course corrections in real time.
Yeah.
Just because of the way things are working with the vaccine.
So I do think things are going very well broadly at that site. I've been pleased
overall. Have we ever done
overall.
anything like this in Chicago?
Not at this scale.
Yeah.
Not at this scale. There's always going to be some things, but I think generally it's been good. So that's where we are. Quickly on second doses, though, while we're on it. This actually is something that one of the ironic things of there being this confusion is that I'd say second doses is like one of the things we have done the best in our entire response, like at CDPH, because from the get-go, we set, this expectation, you are going to get your second dose at the same location, on time, yes. And then we've been allocating from the very beginning, like the whole way we do our allocation, we start with second doses. So the first things that we fill every single week are all of the second doses, either 3 or 4 weeks later, depending on the vaccine. We make sure those same folks are getting it on time. We do some work behind the scenes to make sure people are making their appointments. So ironically, it's actually been one of the things that I think we've done the best on. And not just at our Chicago pods, which have had fantastic second rates, but when we looked at the data last week, almost 95% of people who had gotten vaccinated to date in Chicago had gotten their second dose appointment basically on time, which is really good.
High.
It's really high.
Especially given the concerns that people had about having a 2-dose
Having
vaccine.
a 2-dose, yeah. And, some of those will be your earlier folks who got vaccinated, but still, good job, Chicago, right? And, and we have done just an amazing amount of work kind of behind the scenes to make that happen. It's not easy logistically, particularly where vaccine supply is so limited. But, we really said from the very beginning, safety and making sure that this vaccine is getting administered the way it is intended to be administered is that top priority. And so filling those second doses first has meant we've never left anybody, right, unable to get that second dose, as long as they get it in the same place in the Chicago, right? There's always, I can't control what happens all around us, but related to Chicago's vaccine and Chicago providers, we've always sent, and we always will send the right amount of second doses. And it's a balancing act. But one of the reasons we have, if you look, our fully covered, meaning having gotten 2 doses of vaccine, it's actually quite high. And they're like, you can look, if people are really interested in the data, you can sort of look at first doses versus second doses in different jurisdictions. And if you have, like, ideally, you're going to see both of these sort of march up fairly systemically, as opposed to like a huge surge in first doses and then a drop, and then because you're needing to fill second doses in. So there's been a lot of logistics work on this. And, you know, actually our second dose stuff has been pretty good, but apologies to everybody the first couple days. Really, you've got a second appointment. We just have to make sure you know that you have it.
Okay. Here's one last question about United Center, and then we'll move on to some others. At Beazle the Great from Twitter, when will 1B plus appointments open up again at United Center?
Okay, so a couple things on this. One is that always, you have to, in terms of public-facing appointments that you can sign up for broadly, ZocDoc.com/vaccine remains the place where you will go for vaccine appointments if you live in the city of Chicago. People who do not live in the city of Chicago cannot make appointments, at this point anyway, on ZocDoc.com/vaccine. And I expect, you know, certainly for at least some time, those will be limited to city of Chicago residents. There is separate work happening with suburban Cook County and outside suburban Cook, and there's been some work behind the scenes. But if you are a Chicago resident, ZocDoc.com/vaccine is where you look. And I will tell you, where there are cancellations, and partly because we are seeing people try to sign up for vaccines that they are not eligible for, we are sometimes making quite a lot of cancellations, to be honest. And these are people who attest, right? You have to attest. Like in the early days, I'm over 65, and if people told us they were 65 and over, and then we're not 65, you know, even when they're putting in their date of birth, we cancel that appointment. ZocDoc.com at the United Center only open to Chicago residents. Where there are non-Chicago residents trying to make it, we will cancel that appointment. So where there have been cancellations, we often there is some reposting of that happening on ZocDoc. It's obviously a quick way for us to be able to get vaccines up, get appointments up. So we haven't opened up we've not opened up 8 weeks of vaccine. We haven't opened up huge amounts, particularly with the way things have started here. FEMA is really interested in making sure that we do see some better equity numbers. And so it's been a small number of appointments open. We did this work with prioritizing some of the zip codes that are under vaccinated, went very, very well. We saw those appointments really filled. So if you are here in the city of Chicago, I would say keep an eye on ZocDoc, not just for the United Center. That's your public-facing space, right, for anyone who's kind of got some excess vaccine. I know there's not a lot right now. I do think, you know, as time goes by and there's more vaccine in Chicago, there's going to be additional appointments. But, you know, I expect that there will continue to be appointments. Again, 2 days into an 8-week vaccination campaign, and I think Chicago will we'll see how it goes, but I think there's a good chance we'll extend it ourselves even after the federal vaccination platform is done. So patience, you know, per usual there, but that's where you should keep going. And then there's been some separate work to those 5 zip codes, and we may add some additional zip codes down the line, but none of that is open right now. We're getting through the appointments that are booked right now, about the first week's worth, and then we'll be going on from there.
Okay. Leonore Chen from Facebook, with regards to quarantining, what advice do you have for parents who have been fully vaccinated but have kids under 16 in the household who cannot be vaccinated yet?
Okay, so
now quarantining usually happens when there's been an exposure.
Yes, exactly. So it depends a little bit on the specifics here. Yeah. So if we're talking about in the context of the travel order, which is often where we get a lot of these questions, if it's a travel exposure, then there is not a requirement there. I think you know, the main place where we have made these changes really has to do with thinking about vaccinated people visiting that household. There's not been a broad, you know, because I don't know if these are kids who got exposed at school. I don't know enough about kind of the context of that question being asked. The big change that was made was that, or not the change, but the formal guidance was that if people are fully vaccinated, they can gather, you know, in very small group, you know, like, and that if there is, for example, a grandparent who is going to visit a family where there are unvaccinated grandkids, for example, or unvaccinated adult children, but nobody's at increased risk of severe COVID outcomes, you can go, if the grandparent has been fully vaccinated, you can go, you can hug your grandkids, you can be in that small household setting without wearing the masks. but it's not yet about opening it up very broadly. So people, if everybody's been fully vaccinated, you're allowed to gather. Kids, if nobody's at high risk in these sort of smaller gatherings, meaning like literally like one household
other
level,
household,
type gatherings, would be allowed. So if that was the context of the question, that's the answer. And otherwise, put in a little more details and we can talk.
Okay, you can come back around again,
Yeah.
Leonore. D. Sanders from Facebook, are there any other vaccines from other companies being created?
Yes, really nice question. So in addition to the 3 that have been approved or have been authorized here in the U.S., we're keeping our eye on AstraZeneca. That is a
It's already in use, right?
It's already in use in Europe and some other countries, and it's been, it's been having its studies here, and I am, we'll see. They weren't done yet, but there's been some speculation that, possibly in April we could see that vaccine. It certainly has performed well broadly. It's the vaccine there was some concern about related to the variant that just emerged in South Africa. So there's been some extra attention sort of looking at the vaccine in that context, but it has generally also been a very good vaccine, and I wouldn't be surprised if we see that one potentially getting put before the FDA in April. And then Novavax is one we haven't heard as much about, but they also have there have been, hundreds of companies have been sort of looking at vaccines, but I'd say Novavax is the other one here in the US that I'm kind of keeping my eye on. They're a little further behind in the trials, but their initial data look good. Could that be sort of a May for another vaccine? I think possibly. The thing is, the Biden administration has really been putting a ton of resources into doing everything it can to ramp up production of the vaccines it already has. I'm not sure if you saw, but for example, Merck, who had been in trials for actually 2 different vaccines, the vaccines didn't perform that well. They were safe, but they weren't that effective. They stopped those trials. The Merck ones are not going to come really to market, at least at this point. But the federal government basically convinced Merck to help make Johnson & Johnson because they had facilities and sort of a lot of ability. And so, some of this sort of...
You can share the recipe.
Yeah, some of this sort of cooperation and really incentivizing what might normally be competitive, kind of wartime type effort to kind of get things going. That was really nice to be able to increase J&J because there's a lot of demand for that, and we'd like to see more of it, of course. And then similarly, they invoked this Defense Production Act, which you can use to basically say where Pfizer or Moderna are needing raw materials for the vaccine, they get top priority basically over everybody.
In the
so
supply chain.
Yeah, so there's been, and this is where I think there's a little bit of disconnect, where people have been reading in the news, Biden says we're going to have enough vaccine for all Americans by the end of May, and I'm buying another 100 million on top of it, and we're going to have extra.
And we're like, where is that vaccine?
Exactly. And that is really, those are kind of promised in terms of production and expected to be produced, but they really are mostly...
But the investments are being made now.
The investments are being made now. I remain very hopeful from a kind of late March perspective. It's part of why we're looking at late March for our 1C potential. We do need to know that there's going to be some real expansion to be able to do that. So it's one of the reasons we're watching that really closely. But in the same way, each month has been better. March has, especially with the United Center and the additional, March has definitely already been better than February, but it's still not that great in terms of the number of people who are eligible. I am confident that April is going to be a much bigger month for us, and I am extremely confident that May is going to be then again bigger than April. And the good news is we have built the infrastructure here. We could be doing 3, 4, 5 times the amount of vaccine easily, like every week. I was sitting down last night.
And all the providers who've been doing all of this.
That's what I mean. All the providers, we look at this list. I sat down with the team last night that does this, and they use formulas and other things to do this. But we get a list in like this of people. Everybody's wanting thousands of vaccines, and we don't have the vaccine still, and so. especially the Moderna and the J&J that we use in the outpatient settings, just really, really, really anxious to see some of those increase. But it's going to get better. And this is where I keep telling people that, like, you know, these next couple of months, like, there's going to be frustration. You know, even as every time you open up, there's always frustration because everybody wants to be like first in line whenever you make additional, whenever you open up. But folks who are, you know, who have those underlying conditions, who are in 1C, you're going to have opportunities to get vaccinated broadly for the most part in April and May. Some of you are going to get vaccinated in March, and that's going to be good. But we're broadly going to be able to get most folks done. I feel really confident through April and May.
All right. Don Wolf from Facebook, St. Patty's Day.
Yes.
Easter and spring break plans are being made now. What should Chicagoans consider when planning family gatherings, travel, or other get-togethers?
Yeah. So,
a timely question.
A very timely question. So a couple things. One is that, at least as of this morning, it would have gone up since, but we were at 16.3% of Chicagoans having gotten a first dose of vaccine. That's almost 1 in 6. Pretty good. It's a little better than that if you just do 18 plus. It's more like 1 in 5. But only 8.8%, you know, less than 1 in 10, fewer than 1 in 10 Chicagoans are fully vaccinated. And remember, you got to be 2 weeks post that vaccine before you're even considered protected. And remember, we're still, that 271 cases per day, I'm not loving that. I got to tell you, it is still at a not great level for COVID. It's so much better than we were, but we do have a ways to go to really get that risk when people are gathering down to, you know, that lower risk category. I think we can do it, but when people, you know, think that we're done before we're done, that's when we run the risk of trouble.
And I've seen some of these spring break photos.
Yeah. Yeah, exactly. Like, it's just, you know, I said yesterday in an interview, I said, you know, green beer does not protect you from COVID, right? There is nothing different about St. Patrick's Day that means you should give up on the things that you would normally take from a COVID precaution. So, you know, we're going to have, and there's going to be some more out about this, the business affairs and consumer protection folks, the people who do enforcement around bars, around restaurants, like, those restrictions remain in place. No more than 50%, you know, capacity, and no more than 50 people in a room, in a space. And we're going to be enforcing that. And I would ask everybody, especially, you know, St. Patrick's Day is like a few days away. Like, this weekend, we are not at a gathering point, right? I don't care. Like, if you know, even if you've been vaccinated, it is not a time to sort of say, we're back to normal, let's go. Yeah. Because we are seeing, you know, I was looking, Michigan especially has been doing just beautifully from a COVID perspective. They've really been leading the Midwest, and they've had like a 40% increase in cases over these last couple of weeks. Wow. And they're kind of flirting with our travel order line a little bit. And, you know, hopefully that'll turn around. But, like, you know, Texas went back onto our travel order, if you saw, went from yellow to orange. Texas was like, we're done. No more masks. We're done. We're not done yet, okay? And I want nothing more than to be able to keep opening up. We're gonna keep opening up. We're gonna have a good summer. Like, it's gonna happen unless
we go backwards.
We go backwards. And there are variants, right? There are variants. We're not at a low case rate yet. Things are looking good here, but we gotta just hang on. So try to think about, like, the promise of summer, the promise of sort of things to come. Yeah. You know, do keep your gatherings small. Obviously, we canceled the parade for the second year in a row for St. Patrick's Day. And, you know, and St. Patrick's Day really was, for a lot, we'd been working on COVID for quite a while at the health department by the time St. Patrick's came around. But the real sort of emergence of the outbreak was in March. And it was, I think, canceling the St. Patrick's Day parade was one of the first big things that I think this really broke through for a lot of people, and everything happened really fast after that in terms of, you know, the shutdown. So,
yeah, and I think interestingly, with the promise of vaccine and with vaccine being here, it's almost like it's harder to hang on to this last. You know, you're saying in April this will be better, and it's, you know, you say, oh, that's just 2 weeks away, but I think people are just like, oh my God, I can't go another month.
I know, and we're so close, but we're still, you know, this morning I was looking, you know what percentage of our Chicagoans 65 plus are vaccinated?
What
do you think?
I actually should know the answer to
All
this
right.
question, but I think it's 36%.
It was. We're a little better than that now. Good. We're at 40% this morning, or 42% now this morning. 42% of Chicagoans 65 plus have gotten their first dose. That's not great. I'm going to be honest with you.
Yeah, and March is a month that we
March
really
is
wanted
senior
to
month,
focus on.
exactly. And
Yeah.
so, you know, it was 36% just a few days ago. We're doing a ton, right? This focus at the United Center. We're going to continue to have, you know, anybody who lives in Chicago who's 65 plus, we're going to continue prioritizing for appointments at the United Center. Senior Week has been going on, so we've been doing all of these events in a lot of communities with 500-person events just for seniors. We've got the homebound seniors thing going. We've told all of our providers to continue to prioritize seniors. We've told the pharmacies to prioritize seniors. We have got to get our seniors vaccinated because they are the highest risk for severe outcomes. They're the highest risk for hospitalization and death. And let's be honest, one of the biggest concerns of all of this is not, you know, the young, healthy person who has a mild COVID case that they don't notice, although we do know some people can have, you know, long-term outcomes. But where we've still got such a long way to go in terms of vaccinating older people, I am worried about, you know, it's still at some level the possible, you know, our healthcare system even, right? Like, and these really severe outcomes. So if you know somebody who's over 65, let's get them vaccinated this month. And there's lots of opportunities to do that. And once we're at a higher percentage of those folks done, I'm also just going to feel more comfortable that our most vulnerable folks are fairly well protected. And then obviously the ability to get people with the underlying conditions. And we'll be asking providers, just like we did with seniors, we'll be asking providers, to get started and to start with their existing patients with the highest risk underlying conditions, right? Because you know, providers know their patients and sort of know who is the highest risk. So it's going to be good, but we're just getting started with that, right? And so there are a whole lot of people here in the city of Chicago who are still at pretty high risk for severe outcomes, who've not had an opportunity to get vaccinated. And then remember, they get their first vaccine, it's another month, it's 6 weeks for the people who are getting 2 doses before they're fully vaccinated, right? And so don't get too excited too fast. Like it's good, the news is good, but we need the news to stay good.
Okay, I think you answered John Special's question, which is how much progress have we made in 1B, and 65 plus is part of 1B.
65 plus is part of 1B, yeah. You know, again, we're using all the vaccine we've got. We've been making good progress. We've actually stuck exactly to the schedule that we had planned out in February and March in terms of bringing in some of these essential workers. We got started with the CTA, so we've been vaccinating all the bus drivers and the train drivers and really getting them done. This week we're doing with some of the Johnson & Johnson, we're doing on-site to a lot of the food manufacturing, like some of these food and agriculture that have been major sources of outbreak, hard to keep distance. We're broadly sort of getting through things, but there are still a ton of people, especially 65 plus that we do need to get vaccinated. So
we're doing a lot of work with educators, not just those in our big systems like CPS and the Archdiocese, but have a lovely faith-based alliance that has brought together different schools to get their educators vaccinated, and a partnership with Lurie's to work with daycare and early learning educators. So we've been a lot of work.
We made it through the first responders. Like, you think it feels like it's been so long, but all of this was 1B, right? So made it through and it's basically, this is sort of what we do. You can't just open it all at the same time, especially with these essential workers. We did some prioritization even within that. The Protect Chicago Plus, of course, has been an initiative rolling out over February and March. That's those first 15 communities in terms of really getting a lot of this more focused outreach. And then as there's more vaccine in April and May, we'll be able to be moving on to other, essential worker types, because that's going to more broadly open up. We're going to be able to, hopefully open to some other communities in terms of these very focused activities, because it's all about vaccine supply. That is the thing holding us back, nothing else.
All right. I think it's time for some good news. Do you have any?
I do have good news. So So yes, actually, we brought up Seniors Week here, and we wanted to give a thanks to the Black and Hispanic Owner and Operators Associations and to McDonald's, who have provided breakfast for all the Senior Week events, and that's been really nice. I like it when we're able to incentivize people a little bit to get a vaccine and make it a really festive event. I was at one of the City of Chicago pods the other day, and we've got music and we've got like opportunities to take selfies, and obviously we're making sure all the safety things are in place, but really it is a celebratory thing in a lot of ways for people to be able to get that vaccine. And so thanks to those folks for thinking about how to have breakfast, which I thought was nice. And I think there's a couple of other things here. Obviously, we've had the CPS kids coming back, and that's been some good news. Thank you to everybody.
Pre-K through 8th grade. Special cluster students.
So, everybody who's been working at every level to make that, absolutely make that safe return possible. And we continue to follow the data there, not seeing anything surprising. And the news has also been good there as well. And I think, there's some notes here from Invest Southwest, which, back to where we started a little bit around really thinking about prioritizing investments in some of the neighborhoods that have historic disinvestment, and what do you do to create jobs and to create opportunities and really make a stronger Chicago. They're investing about $65 million, transforming 3 vacant lots into developments that are bringing jobs. There's a mixed-use residential complex that's going to have a blues museum and a cafe, as well as some housing in Austin. There's a sustainable culinary and urban farming campus in Englewood. There's a 56-unit affordable rental building with tenant gardens in Auburn Gresham. And I know that those projects, we're after a lot of engagement with community groups and residents. And, this sort of thing is part of this. How do you bring some of this transformative change? How do you, make neighborhoods healthier in every sense of the word? So anyway, I like seeing some of those sorts of things. So even though it's not directly in COVID, I think it's indirectly in sort of COVID and sort of long-term response and really building a stronger Chicago for everybody.
Yeah. I'll just add, our park district has spring session coming up, and you can enroll, and they have in-person activities for the kiddos. So for all of us parents who've been cooped up in the house with our children, there's some opportunities for them to get out, of course safely in pods, just as we see in schools. But a chance, especially as the weather changes, for our young people to move around. So check out those programs on the Park District.
Yeah, I want to make sure kids get moving, right? As we're sort of coming into spring weather here, and certainly COVID risk continues to improve, making sure that we're thinking about our physical health. I went swimming this morning, which I had not done in a while, like trying to sort of, let's think about health in lots of ways as we're kind of moving ahead. So yeah, that's good. And Chicago Parks District was one of the spaces that over the summer even
oh my God,
like really
it's
had
a
very, very successful programming, not seeing COVID outbreaks, really, really good at like safety. And, it was one of the reasons we were really confident related to having schools back in session was how well the Parks District had done. And as early educators, there's been vaccination there as well. So yeah, I would give a thumbs up to the Parks District programming as well. Two thumbs up.
That team is amazing.
Yeah, definitely.
All right. So, let's all keep doing what we're doing to keep our city protected. Waiting for our turn, but knowing that the turn is coming.
Yes.
And whether you've taken your turn or not, doing the basic things that we know make a difference. In terms of wearing masks, keeping that distance, hand hygiene, those things still stop the spread of COVID, so we have to keep doing those things.
Absolutely. And as the vaccine numbers keep getting better and the case numbers keep getting better, we're going to be able to bring back the things we love carefully.
All right. Well, we'll see you on Tuesday.
Yep. Put your questions in. If we didn't get them to you today, look online, chi.gov/COVIDvax. We update that website every single day. So if you've got more questions, that's your best place for answers. Thanks for tuning in. Bye-bye.